Okay, so we want to make sure that we are at a 40-inch SID for T-spine. We want to make sure that our tube and bucky are aligned. Our collimation is going to be 17 inches in length, and our width only needs to be about 4 to 5 inches. We want to center at T7, which is 3 to 4 inches below the jugular notch. So you can find the jugular notch, go about 3 to 4 inches below that. Make sure that you have about 1.5 inches of light above the shoulders up here, and that's a good place for you to put your marker as well. And then I want you to come up to the head of the bed as well, just to make sure that your patient's straight and that they're nice and centered there. So then what I would have my patient do is take in a nice big deep breath, blow it out, hold it out, and I would take the exposure. Then for the lateral, I'm going to have my patient roll onto the left side so you're facing that wall. Bring both hands together in front of your face and both knees and feet right on top of each other. It's really important with the T-spine lateral to make sure that there's no rotation. So to do that, just like we did with the chest, you want to feel both of the scapulas to make sure both shoulders are sitting right on top of each other. But you also want to check the hips as well. So on the lower back, you want to feel to make sure that the hips aren't rotated. It's really important to do that. So we want to find T7, so we can use the vertebral prominence, make sure that we're centered at the level of T7. And then we want to be back about 1 inch from the mid-coronal plane. So you should have a little sliver of light right back here behind the T-spine. Your light is going to hit about the head of the humerus because you're going to have the light for the swimmer's view, or you're going to have the image for the swimmer. So again, you're either going to use a breathing technique for this or on expiration. So if it was a breathing technique, I would instruct my patient to just take short, shallow breaths. And then I would take that exposure. For the last few, for the swimmers, I'm going to raise my SID up as high as it will go, which for in here is probably about 48 inches. I'm going to change my collimation to 10 by 12. I'm going to take this pillow away from you, and what I want you to do is bring your left arm under your head like a pillow, and then bring your right arm right down the side of your body. There you go. So we're trying to separate the shoulders here so that we can see the area of C7 and T1. I'm going to put a 5-degree angle on the tube to kind of help separate them as well, and then I want to realign my tube and bucky. So I want to center right where the neck and the shoulder meet. I'm going to have light to about the humerus, and then I want to have light up to the EAM. You can turn your tube, your collimator housing, just a little bit so it's going in line. Our neck kind of naturally curls forward when we lay them down. So you want to make sure that you have light just grazing the back of the thoracic spine so you don't clip the spinous process. All right, and then again, I would have my patient take in a breath, blow it out, and relax that right shoulder down as much as you can. Good, and then I would take that exposure.